have 10 a.m. Central Standard Time on my clock, and in the interest of time, I thought we could go ahead and get started. Really thrilled to have you join us today for another very exciting webinar hosted by The Bold, Building Our Largest Dementia Infrastructure, Public Health Center of Excellence on Dementia Caregiving. My name is Joe Gogler. I direct our center, and today we're very exciting to present an area that I think has amazing potential in the space of public health, dementia, and dementia care, and that's using crowdsourcing to support dementia caregivers. Um, I had the pleasure of serving as a discussant at a fairly late night panel, or late panel, I guess, at the Gerontological Society of America meeting this past November. And the theme of that particular symposium was on technology, chronic health, and aging. And I had the pleasure of hearing Dr. Ruggiano present some of the really I would consider groundbreaking and cutting edge work that's happening in Alabama around using technology to crowdsource information and resources to better support dementia caregivers in those communities. I've known Dr. Ruggiano for several years now. She contributed an excellent chapter to a book I had edited a couple years ago called Bridging the Family Care Gap on health information and technology and caregivers and the policy ramifications of that. Hint, hint, if you would like to get the book, please do get it. It's still available and still very relevant. But nonetheless, we're going to be focused today on this very exciting topic. So thank you. I'm going to turn it over to Maya Kofsky, the Bold Public Health Center of Excellence on Dementia Caregiving specialist, and she will take us through some introductory slides and logistics. Thank you.
Thank you, Joe. Very exciting to see everyone here today. As Joe mentioned, my name is Maya Kofsky, and I provide support to the Bold Public Health Center of Excellence on Dementia Caregiving, as well as the Center for Healthy Aging and Innovation here at the University of Minnesota School of Public Health. And I'm excited to have the honor to kick off this meeting today and looking forward to a great discussion. So we just want to take time to acknowledge the land and virtual space we are sharing today. So the University of Minnesota Twin Cities is located on traditional, ancestral, and contemporary lands of the Indigenous people. We acknowledge with gratitude the land itself and the people. We take to heart and commit through action and to learn and honor the traditional cultural Dakota values, courage, wisdom, respect, and generosity. So just to provide a brief overview of the Bold Public Health Center of Excellence on Dementia Caregiving, or PICO, as we like to call it, for those who might not be familiar. The center is designed to support state, tribal, and local public health agencies nationwide in developing their dementia caregiving focused programs and initiatives by improving access to evidence-based programs and best practices, facilitating connections and collaboration among public health agencies and a wide range of service organizations, and providing technical assistance for identifying, selecting, and implementing effective public health interventions and strategies. We also wanted to briefly highlight the Healthy Brain Initiative, or HBI Collaborative. It's a group that includes population experts, national coordinators, and subject matter experts with the goal to reduce the risk of impact of Alzheimer's disease and related dementias through integration of cognitive health into public health practice. You can learn more by visiting the HBI Collaborative or by scanning the QR code there too. And we just wanted to say we greatly value your feedback. So we ask you to please take a moment to complete the survey before you leave today's event. You can scan this QR code or click the link in the chat as well. All right. And just a couple reminders for the presentation. Please submit your questions for the speakers into the Q&A feature. Please raise your hand if you wish to speak and only unmute if you are prompted. We will have some couple questions raised by the presenters during the presentation, so please just be sure to raise your hand if you would like to verbally contribute. We would like you to use the chat to share comments, resources, links, and ideas. And feel free to use your reaction buttons. We'd love to see it. And the recording, slides, and resources will be shared after the event today as well with all attendees and registrants. And then just another reminder to please complete the survey at the end of this event. It will be linked in the chat. We really appreciate your feedback and value what you have to say, and we try to make improvements based on that. So thank you so much. So now time for a brief poll to get a better idea of who is in attendance today. Just take a minute here. All right. Looks like we have pretty diverse audience here today in terms of organizations represented. Awesome. Thank you so much. All right. And I would like to provide a warm welcome for our presenters today. So Dr. Nicole Ruggiano is a professor and associate dean of research within the School of Social Work at the University of Alabama in Tuscaloosa. She is also an affiliated scientist for the University of Alabama at Birmingham Alzheimer's Disease Research Center. Her research focuses on developing and testing technologies that support people living with dementia and their families. Dr. Ruggiano is the lead researcher for the Alabama Caregiver Connect initiative, which connects those impacted by dementia with information about dementia caregiving and available resources. Dr. Monica Anderson is currently an associate professor of the Department of Computer Science at the University of Alabama, Tuscaloosa. Her current research interests includes mechanisms to improve operator interaction with teams of robots or agents, technology-enabled participatory community asset mapping of caregiver resources, and identification of mechanisms that broaden the participation in computer science programs by persons from underrepresented groups. And Dr. Zi Jiang is an assistant professor of the Department of Computer and Information Science and Engineering at the University of Florida. His research interests include data mining, machine learning, artificial intelligence, with a particular focus on data mining for interdisciplinary applications in earth sciences, agriculture, transportation, public health, and medicine. Thank you all so much for presenting today. And with that, I will hand it over to you, Dr. Ruggiano.
Thank you, Maya. And I'm very excited that Dr. Anderson and Dr. Jiang can talk about our work to those of you who are working in the communities and trying to address a lot of these challenges that we're seeing for caregivers and their families and people with dementia in general. Maya, can you go to the next slide, please? And I just want to acknowledge that our work has been funded through the National Science Foundation. Next slide. So I've been working in the dementia technology space for about 15 years, and a lot of the work that I've done has been more clinical focused, but looking at some of the public health issues related to dementia in Alabama specifically, I started to develop more of an interest in looking at what community-based technologies could help caregivers get more information about dementia and caregiving and link them better to services. So just an overview about the current state of dementia in Alabama. We have about 110,000 people living with dementia, and of course that's diagnosed. We know that there's going to be a lot more people who are not currently diagnosed that are living in the community, and they're cared for mostly by 216,000 family caregivers. However, Alabama has the third highest mortality rate for people living with dementia in the United States, and that's for a myriad of reasons, but some of them also include, and you could pull down the rest of yeah, there you go. And so part of that's due to the large rural communities that we have. People have geographic barriers to getting the care that they need. And we also have a severe shortage of geriatricians in the state. We have a shortage nationwide, but in 2021, there were only 33 geriatricians, and it's estimated that by 2050, just to serve 30% of all older adults in Alabama, we would need about 650 geriatricians. So this is a significant shortage. We also have communities that have been on the dealing with a lot of disparities and social determinants of health. Some of that's related to the rural communities that I mentioned earlier, but there's also been historic barriers to healthcare, especially in the Black Belt communities of Alabama, which is mostly a rural agricultural. That's where it gets the name Black Belt because of the soil. These are the communities that have been negatively impacted by things like the U.S. Public Health Service syphilis study on untreated syphilis in the African American population. So there's a lot of mistrust in the medical communities and research communities, and that also creates an additional challenge for public health initiatives. And next slide. So if we look at the challenges that caregivers have reported, and some of this is in the literature, and a lot of it's also what caregivers have reported to us, and you can just pull all of the, yeah, there you go. Thank you. So they're basically saying they lack information about resources. When I interview caregivers, it's not uncommon for me to ask questions like, have you been using respite care? Have you gone to caregiver support programs? And this is the first time that they've ever learned that those types of programs exist. So they know that they need help, but they don't know that there's help actually out there. They say that primary care providers, they're not referring them to non-medical support. So even when they talk to a physician or nurse practitioner about some of the non-medical things that they need, they're not really getting information from the medical community as much as they would like. They lack support systems. There's service challenges in rural communities that I mentioned earlier. And so in terms of finding information just about dementia, caregiving, or resources, they're typically going to the internet to find those things, but technology literacy really varies among caregivers, and so the search results can be pretty overwhelming. So those are caregiver reported challenges, but we also have challenges related to this from providers. And so next slide. So if we look at the provider reported challenges, they lack awareness about what available support services are. So that's why they're not referring. They're not sure what's in the community, or they don't know enough about what's in the community to feel confident in making those referrals. Also, information is really fragmented. And even when we were pulling together our NSS proposal, Dr. Anderson and I, we did a focus group with community-based providers. And it was really interesting listening to some of the challenges that they brought up about just even resource lists and directories, that they're often incomplete. They can easily become outdated. So you can, for instance, if you change locations, you could update Google Maps, but it might take some time before that actually updates for people who are searching for your organization. And they typically don't include less formal services. So for instance, you might have local churches that have their own respite services for the people who go to church in those communities. However, they're not going to be on a formal resource list with for-profit and nonprofit respite care services, for instance. And so we're not able to capture a lot of what is available. Next slide, please. So to show how all of these things come together in terms of everyday experiences of caregivers, I've pulled together a couple of cases, and these are fictitious cases, but they're very common. So here we look at John. John's an older African-American man. He lives in Tuskegee with his wife who has severe dementia. And John feels isolated. He lives in a rural community. And so when they're at the primary care provider, he asks them about, where can somebody just stay with my wife so I can go to church once a week? Are there services like that? And they don't know. And so he continues to feel isolated. Another case on the next slide. Another case is Anne. So Anne, she's younger than John, and so she has more experience with computers and searching on the internet. And so recently her father was diagnosed with moderate dementia, and so she moved to be near him and to be supportive of him. And she really thinks that they would benefit from having him attend an adult day center while she's at work. So the first thing she does is what most caregivers do. They go to Google, and so she searches for adult daycare, those terms. And about 12 million hits come up for all different types of care: child daycare, doggy daycare, daycare that's not, even located in Alabama. And so she becomes very overwhelmed and then puts off selecting a place to take her father. And so therefore, they're prolonging services that they need, which can have other negative outcomes. Next slide, please. So the questions that I started thinking of is, how do we create an educational and information resource about dementia that is dynamic, that can change easily over time as services change, whether we get more services, some services are no longer available, and where they're located. And how do we make sure it's accurate? So one thing the providers in our focus groups told us is that if the information does not seem accurate, people do not want to use those resources. And so how do we make sure that it stays up to date? Can we create it so it self-monitors for accuracy? So one of the reasons why things are out of date in terms of resource lists is because we have to wait till somebody who manages the list to find out that there's changes needed and make those changes. And so is there a possible way that we could develop a software algorithm that can look out for those needed changes and self-monitor for accuracy? And then this is the part that led us to crowdsourcing. Can we harness mutual support that already exists in the caregiver community? There is a reason why caregiver support groups are a popular model in the dementia caregiver community. It's because caregivers not only go to them for their own support, but they always say that they want to help somebody else in their situation. And in fact, over and over in my own research studies, when I interview caregivers, they tell me that that's why they're signing up, that they feel like they could give information that another caregiver could use. And so if there is this trust and strength in mutual support within the community, how can we harness that in a technology that can be more community-based and community-driven? Next slide, please. And so this led us to talk about community-driven asset mapping technologies. And that sounds very fancy. If you think about how I initially presented it to Drs. Anderson and Chang, my thought was, we have Angie's List that really helps you find services in the community, and Google Maps that helps you find out where things are in the community. And I literally went to them and said, if Angie's List and Google Maps had a baby and it only dealt with dementia, what would that look like? And that actually turned into a funded National Science Foundation grant for planning this project. So taking these ideas and telling the National Science Foundation, if we answer some of these larger questions about what a technology could and should look like, that we could build something that could better support communities. So I'll go over what asset mapping and crowdsourcing is in the next couple of slides. So community asset mapping, this is actually a common public health approach. And we previously did a systematic review of public health studies that use asset mapping. And so we learned that there's all different things in public health that people use them for, whether it's, I think we've seen like smoking cessation, diabetes management. We didn't really see anything related to dementia or cognitive health, but we know that it's something that is commonly used. And so these asset maps, they document where tangible and intangible supports might be for any particular need. Some of these are on actual maps, and some of them wind up becoming more resource lists. But oftentimes communities are the ones who are involved with gathering the mapping data. Next slide, please. And so with communities being the ones that often populate the map, this brought us to this idea of crowdsourcing mapping. So crowdsourcing mapping would be where you have maps and the information on the app is really driven by volunteers who are stakeholders to enter the resources that they think would be of interest to people who are using that app or asset map. And so it really can harness the mutual support already found among caregiver communities, because we can have a model where community members, caregivers, their family members, providers in the community can actually be the ones that are informing the map and saying, these are where resources are that might help meet your needs. Next slide, please. And you might have already used a crowdsourced asset map. So here are two examples that people are often familiar with. On the left, we have Gas Buddy. And so Gas Buddy works. If you want to find where the cheapest gas is in your area, everybody who uses the app, they enter in the app when they're getting gas, how much they're paying per gallon. And so this will populate a map. And if you want to get gas where it's cheapest, you can open the map and see where has been the least expensive gas in my community. And you can just go directly there instead of trying to compare different prices of different gas stations. Waze navigation and live traffic also is a crowdsourced asset mapping. So many people use Google Maps, but Waze is known for the ability of people who were using it to indicate during their travels what are the conditions of their trip. So if there's a speed trap, they can alert other drivers. If there is traffic, if there is an accident, they're able to not only add to that, but Waze has an algorithm that identifies when people are no longer reporting the same incident on the road, and then it removes it from the map. So it also has the capacity for self-monitoring. Next slide, please. And so some of the long-term goals of using this in Alabama is that, so our initiative, we called it Alabama Caregiver Connect, and we would like to develop the community asset mapping software for dementia resources and services. And so we would have to develop a crowdsourced protocol for populating the map. So how do we devise some sort of technology that people will want to use to voluntarily give information about where resources are located, and then test the feasibility of local community members populating the app and using it for information seeking. Next slide, please. So some of the questions that came up early on in our planning project is, what information would lead people to use the app? How do we address data quality? So if we have the community providing information, how do we know people are not using it for nefarious reasons? How do we create an app that supports varying digital literacies? That's another challenge. And so part of this project included interviews, focus groups, and a statewide survey. Although we would have liked to have surveyed more individuals, we had to do this during the pandemic, and so that created some barriers. But overall, we were able to get a wealth of knowledge about what the status is with information seeking and what people's interests were. Next slide, please. So some of the things that caregivers said, basically they said that they would be willing to use this type of technology. And I know that saying that somebody is willing to use it, whether they do use it, it can be two different things. But it's almost, 2/3 or 3/4 of the caregivers basically said that they would not only use it to find information, but they'd be interested in using it to share information with others. And some of the things that most commonly they said they would like more information about: respite care, identifying services that their insurance covers. And that's been a big thing that caregivers feel like they have to call many places just to find out where they can go with the insurance or with the finances that they have. And they also want more information about stress relief and support groups for caregivers. Next slide, please. And then when we talked about this with providers, I mean, very similar to what Dr. Gogler was saying in our GSA presentation back in November, you know, he started thinking about this, and there are some ways that we could really try to implement this technology. So when we talk about it, people are already starting to think about how could this be useful. And so providers have said things that this could be a potential for helping more families make informed decisions. So if we can have a map with what's in your community and information about those resources, then people can, for instance, maybe be more informed when they're trying to select services based on the quality of services or different aspects of care. Some providers in the community said that they thought it could also improve business competition, especially in unregulated markets. So there was a concern by some non-medical home care services where they said that, you know, it's not a regulated market. And so you have the providers who are investing a lot of money into, you know, advanced training for their caregivers, checks and balance systems for quality and safety. But then they're competing with mom and pop operations that might be perfectly fine, but they are not necessarily putting the same level of rigor and support in terms of safety and security. And so some of them thought, well, this is actually a way of helping caregivers in the community evaluate services for safety and for quality. We had individuals who were providers and clinical researchers who thought that this would be a good way to use for recruitment purposes for different studies. You know, in Alabama, we have a number of faculty at UAB who are conducting studies on dementia, people with dementia, caregivers, and so trying to recruit individuals for all these studies, this could be one way of getting information out about what studies people might be interested. And actually, that's something that our initiative has been focused on, is even teaching people what does it mean to be in a research study, so people could be more informed about signing up for those things. It could be used for identifying gaps in service delivery and even possibly creating a caregiver registry that can be used by researchers, but also by public health officials. Next slide, please. And so in looking at BOLD and what are the goals of BOLD, there's other ways that this could be useful specifically for the BOLD initiative. So it can help you collect data that can evaluate progress towards the brain health roadmap goals. Educational and training outreach for general public, primary care providers, and non-medical professionals. You know, I was appointed by the governor on the Alabama Lifespan Respite Coalition, and we meet a couple times a year. And when we do meet, it's very interesting that by the end of the meeting, everybody wants to throw out there like all of the trainings and supports and events that they're having, so that the other people who are part of the coalition can know. And so, you know, that also made me think about how we're talking about caregivers knowing where to get information and having a hub, but providers don't necessarily have a hub to show others what they are doing in the community very easily. And then support and tracking things like awareness and understanding outcomes. So how many people are exposed to messages about dementia? Using a technology-based platform, you can actually identify how many people are accessing those resources that you have. Where are those people located? What are the different messages they might be accessing? So that could be a helpful tool for that as well. Next slide. Oh, And and so as a hub, as I mentioned earlier, it can help really facilitate clinical community linkages, that it would be something where people could have, about their local communities, that providers can tell each other what is available. So we wanted to build into this presentation some questions for all of you, because most of you are going to be the people who have the boots on the ground, and just open it up to what do you all think? Do you see ways that you could implement this app in your state or local community? Some of you are most likely in states that have very similar situations as Alabama, and then some very different. We are working on building this technology and then getting additional support from the National Science Foundation to build it. So this is really an opportune time to find out from all of you about what this could look like for different states. So I guess I could just pause and see if there are any questions that come up in the Q&A, or if anybody wanted to raise their hand.
Yes, if you do wish to ask Dr. Ruggiano a question, please put it in the chat or Q&A via text, or you can raise your hand and using the Zoom function, and then we can see if we can't get you to speak your question and answer it live. So I see Jane Carmody. Hello, Jane. How are you? Great to have you. Please.
Oh, thank you. I don't want to take others' times, and if I got my camera working. So great information and such a great need. I just wanted to mention it, and I don't want this to sound like a commercial, but for years we have been supporting a team to look at evidence-based programs for family caregivers, so that we know there's a lot of programs out there, but we wanted to be very clear that we are listing programs that are proven, that they have been work in a community, not just an academic setting, and that they work with diverse groups, etc. So that's best programs for caregiving, and that has just launched actually last week, because before that we were trying to build up professional organizations to provide these services. My question to you is, and it's a website, I love the idea of the app, where do you think that would fit in, Nicole, in the work that you're doing, and how could we use the good work that we've done with ACL and all that to create this list?
Sure, that's a great question. Thanks, Jane. I think, the two different goals of the initiative, to link people with information and to link people with services, those are really converging with what you are all trying to do. How do we not just expand services for this population? How do we get them to have more evidence-based options? But how many caregivers know what evidence-based means? And then also, how do caregivers possibly understand how to evaluate evidence? That's something that has come up many times in the providers in our communities, is that caregivers might be accessing things that they think are evidence-based, but they don't have any idea. And part of that is just, sometimes journalists do a good job at reporting research findings, and then oftentimes it's very confusing to everyday people who are trying to read. People asking, I saw a study that blueberries can prevent dementia. Is that true? Right. And it's like, well, no. And they don't know that study was maybe done with a very concentrated chemical compound on mice. And so, so I think where something like this is helpful is that you can design this type of app so that you can control what kind of information and quality of those resources are delivered to the public. So going back to what some providers said, this could help people make more informed decisions, because it could be a really great way for lay people to better understand what they're supposed to be looking for in terms of a trusted service.
Thanks.
Yeah, I'm just going to add one thing, Joe. That is That's why we did this, so that people wouldn't have to figure it out themselves. As you said, who knows what's proven or evidence-based? And I think there's a way to link it. Our work is placed on Family Caregiver Alliance, which is the #1 spot, usually when you go searching for caregiver support. But of course, we are very, very aware of
So Jane,
the work that it takes for dementia.
Jane, one thing to clarify quickly, and then we'll have to transition to our next speaker. Again, for those of you who are speakers, I'm seeing there's a number of questions being submitted through the Q&A. If you wouldn't mind addressing those via typing, or we can answer them directly at the end of our presentations. So Jane, just to clarify, the program you referred to, is that best practice caregiving, or is it something different?
There's two now, Joe. Best practice was for
Okay.
professional groups.
That's right. And now,
cost now best
right.
Best programs for caregiving now has been vetted for
Great,
2
Joe,
years,
and
3 years
wonderful. And I see, Jane, you
families.
put the link in the chat. That's exactly what I was going to ask. So thanks for doing that. Alma, if you could please get that link up, we'll put it on our webpage too. I think in the interest of time, we do have to go on to our next speaker. And I believe that is Dr. Anderson. Dr. Anderson, please.
All right, great. So I saw there was a question that asked about how do we inform caregivers about the service. And we do currently have a website that Dr. Ruggiano referred to. And right now we've actually had quite a few hits. There's a lot of activity on that site. So we've been kind of using that as kind of a jumping off point to provide information or to, disseminate information to caregivers. So this is our website. Next slide. Okay, so one of the first tools that we put together was the tool where anyone can find the area agency on aging in their county. So if you go to this web page, it will actually try to locate where you are based on your IP and actually highlight the county that you're in. If you're outside of the state, then you won't get that little drop because it's only for Alabama. However, you can click on any state, hover over any state, or I'm sorry, any county, hover over any county or pick a county out of the pull down. So there's lots of modalities where people can identify different area agencies on aging in different parts of the state. And one of the key ideas here is trying to create something that is very, very usable for people either on the cell phone or people with limited dexterity or people who may actually have maybe some vision issues. Next slide. So this is another page from our website, and I think our website URL is actually in the chat, so you can actually take a look at this, but we're also disseminating information as articles, and most of the hits that we get to our website are actually on the Caregiving 101 page.
And also just to throw in there, this is community driven. So there is a feature on our website where community members can actually ask us what we can put on the site, what they'd like to learn more about. And so we developed this educational tool based on what they're telling us, and they are asking for different information. Go ahead, Dr. Anderson.
Okay, next slide. Okay. All right. So we talked about this idea of crowdsourcing information. And so the first part of crowdsourcing information is getting the information into the system. And so what we want is to have a suggestion page or a tips page with a very low barrier of entry, so that although we would love to have all the information about a possible source, we want someone to provide to us as much as they have. That way we can at least be aware of something that we need to investigate. And so in this screen, and we also would want them to be able to do it via phone, maybe via Alexa. So this is just kind of an idea of a form that would be on our website. And so these are all the information that we would like to get from a user, but if a user doesn't have all of this, they can say unknown or they can leave it blank, and that's fine. Next screen. So here, what we will do is we will keep track of all the suggestions that we get. And what our armchair citizen scientists will do, our moderators will actually look at all the open suggestions, and they will go through and vet them and try to complete the information, determine if it is truly a resource. And the good thing about this is we also can take information that maybe 6 months ago someone told us about a resource. And every 6 months we want to go through and re-vet that resource to make sure that resource is there, that it's at the same place. Maybe we're keeping track of the time, maybe the contact has changed. And so this not only allows us to kind of moderate and vet possible suggestions or tips or resources or services, but it also allows us to kind of re-vet and re-look at things that we've looked at periodically. So we have two kinds of users. There is an anonymous user who can at any point put in a suggestion. Then we have moderators, or much like Wikipedia, someone who looks at the suggestions and vets them before they get added to the database. Next slide. So the real challenge in doing this is not so much collecting the information, but to create interfaces that actually are usable for people. And so in computer science, we have something called user-centered participatory design, where we actually work with users to decide what information they need, what information they don't, what's the best way to actually present it. And so in this screen, we're looking at very specifically this tip on a food pantry at a Tuscaloosa church. And so one of the issues is we only want that church in our database one time. So the person who suggested it, we could create a new provider. However, we would also want our moderator to select an existing provider. So we don't want to have a provider in the system multiple times. So once we get either a new provider or an existing provider, then we will go to the add the food bank details. Next slide. And one thing you have to keep in mind is that you can have a single provider that provides many services. An area agency on aging is a great example. So once we have a provider, then we will actually add the information on the specific resource. It's important to keep those separate. Right now, I think we have 47 categories because that facilitates searching. So if someone, say, is looking for research studies, then we want those to be categorized under studies versus food banks and bill assistance, that kind of thing. The other part that's really important here is kind of this geographic piece of the information that we need to provide. So we also have this concept of service areas. So if there's a resource, the service area is either a city, a county, or maybe it's a distance from where that location is. That also allows us to query and give someone very specifically the service that they're looking for in the area that they need it. And so that allows us to kind of locate services based on where they can be used. Next slide. So the last part of this is we actually started with populating the database with Medicare providers. So if you go on to the government website, you can actually download a list of all the organizations in the state that have been reimbursed by Medicare. So we actually start with that information. The one thing about that is we know that they at least are qualified to be paid by Medicare. So that's actually really important. Although that information is rather old, it's lagging. But the government will give you access to suppliers, long-term rehabilitation centers or home centers, in-home health, and hospice care. And so we can pull all of those in. So right now we actually have a database of 903 providers. Next slide. I think that's it for the development process. Next slide. All right, back to Dr. Ruggiano.
Great. Thank you, Dr. Anderson. I was just trying to answer some of the questions that were in the chat. So we look at our community engagement with Alabama Caregiver Connect, and one of the questions in the app was, how do we get information out about the initiative? We've been successful with really 2 public radio stations and having them announce what Caregiver Connect is and how they can access it. And so that's really been helpful. We've also had coverage in print and television news. In fact, we had the local ABC evening news. They not only did a story, but they put Alabama Caregiver Connect on their website and showed screenshots of it, which, I was jumping up and down in excitement. So I think that people who see this as a good tool are interested in sharing it. And we think that that is going to be how we can get more community outreach moving forward. But since then, we've had more than 1,600 individual users from 10 countries access the app with 2,700 page views. And the Caregiver 101, that has basically been the most accessed pages that people want to learn, from experts, answers to their questions. We've had 39 contact form submissions, and several foreign nonprofit agencies have reached out. We've had a number of commercial entities ask if they could be listed on our app, and we have declined thus far. We're trying to keep it local and nonprofit at this point as much as we can. But we're just a small team of researchers, so this isn't probably as many hits as you would get on care.com or similar commercial sites, but we think that we've done a really good job at getting community reach and participation, making this community driven and with two-way communication. Next slide, please. So over time, we have identified what are some potential challenges and what could be possible solutions, because now that we're going to go for an additional grant to further build the technology, in addition to what Dr. Anderson has been working on in some of the infrastructure for the app, we've had a lot of questions come up that we had time to think more about and think how we would problem solve. So next slide, please. So crowdsourced data can be noisy, and this is really where Dr. Jiang's area of expertise on geospatial data. So in terms of being noisy, it could be inaccurate. It can be maybe not entered the way that it should be in a database, for instance. And so if you have everyday people adding information to the app, how do we make sure that it's accurate? Well, we can develop algorithms that assess for accuracy in the data. So for example, if several people put information in the app about this one agency, and then somebody else puts one in, an entry that's a very similar sounding agency at the same location, we could work on developing algorithms that look at patterns in what people are entering and weed out which ones do not fit those patterns. Information needs vary across cases. So if you've seen a caregiver situation, you've seen a caregiver situation. But we can develop protocols for what people enter into the database that have clear categories of caregiver needs. So what we would like to see is if a caregiver wanted to just use the app, not necessarily enter information into it, they could list what their needs are, and then the map would just show them where they can get what they needed. How do we prevent predatory, misleading, and false information? So as Dr. Anderson mentioned, a citizen scientist model, and this is something that we see, I review a lot of grants for the National Science Foundation, and this model is really used a lot more in other areas. So for instance, environmental science and technologies, where everyday citizens who want to be a part of this project can sign up. And so we could have different interfaces where those who just want to use the app for information seeking can do so, but you could also register for an account where you are, one of our caregiver crusaders, let's say, in the community, or a provider. And so if we find that there is questionable information being entered onto the app, we are able to identify the source of that information and then address it appropriately. And how do we stay relevant for rural communities? We need more end user testing in remote communities, particularly rural communities. What we find in some of the work that we have done evaluating tech-based support for caregivers is that we often say that they're good for rural communities, but then there's not that many studies that just focus on testing these devices in rural communities. And so spending more time doing that up front can be helpful. Next slide. So I believe this is the end of the presentation. And so I guess just additional questions that anybody has, we'd be happy to answer. Or if anybody has thoughts of how public health departments could get involved, if they want to be involved, you know, we are working on expanding the work that we're doing, and so we're happy to talk to other stakeholders who might have an interest in the project. And so so that's the end of our formal presentation. I can open it up to any additional questions that there are, unless Elma, if you wanted to take it back.
Sure, thank you. This was such a great presentation. Thank you for bringing this topic. It has so much potential and so many possibilities. I think we have about 8 minutes left, and I would really like to hear from public health agencies that are here with us today. What are some thoughts that come to mind? What are the key questions that you might have for this team? And while maybe they submit their questions, or feel free to raise your hand, Dr. Ruggiano, Anderson, and Zieng, maybe you can start by sharing a few building blocks. What should public health agencies start thinking about or planning for if they want to implement a platform like this? What should they look for to replicate this, to improve it?
Yeah, I mean, I think the big things are to think about what the information needs are in those communities, and that might differ based on culture. So I know I have somebody who is in the chat asking about, you know, could you search for by county or tribal resources? So how you develop the tool can vary based on the location. So I think trying to figure out what is the most important information that we need to have shared, and then how could we get people to share that in this format? I think that, or who should be the ones involved with sharing the information? Those are the larger questions. I see Donna. Oh, go ahead.
Yeah. Donna, would you like to unmute yourself or come on camera and ask your question?
Sure. So I'm Donna Barrett. I'm from Summit County Public Health in Akron, Ohio. So I can see how we use mapping here a lot at the health department, and we have dashboards. So I definitely can have a conversation here about how could we develop this caregiver resource platform. I don't know about the app piece, but I think there's always the feasibility of doing that. But I think I also sit on a committee with the Ohio State University, and we've recently pulled together a resource directory that we have not implemented yet, but is focused on dementia and caregiving. And I could see this naturally being having an app as a way to keep up to date on what these resources are in the community. I like the idea of the crowdsourcing, because how do you manage those resource directories over time? We know that the information gets outdated, and so the next time I meet with the Ohio State group, I'm going to share this information with them to see if they might be interested in maybe reaching out to you all to partner maybe on a further project for the state of Ohio.
No, I would definitely love if you got in touch with us to talk about that. And in terms of the accuracy, I think that's one of the things that made us think about adding the picture of Waze. There are apps that use crowdsourcing. Waze, like I mentioned, once people stop reporting an accident, the app takes it off of the map. So if we create a program where caregivers who are just using it to find information indicate when they've done it, Once we see that people aren't using a specific resource anymore, we can check in on that organization. The whole idea is how much can we automate to reduce administrative burden of managing the database and the map, so that way it's cost effective, but we can actually use the information provided by users to create that automation. So that's really the larger tech-based problem that we're trying to answer in this project.
I also see a question that Dr. Anderson is trying to answer, is working on answering in the Q&A that I think is very interesting. It's about sustainability. And somebody else posted in the chat earlier, how do we keep this from becoming a marketing tool for companies? So what is the sustainability model in the long term for this, and how, any ideas?
Yeah, go ahead, Monica. You look
Oh,
like
no,
you're
you
gonna
go ahead.
say something. I was just going to say that the actual model of the crowdsourcing and utilizing the individuals in the community to gather the information and then creating an algorithm to help manage the information, that reduces the amount of manpower that goes into overseeing this database, this technology. And so it makes it more cost effective for it to be used by nonprofits, by public agencies. But, you know, I think having strict policies about what the stance is on for-profits, we have had commercial companies across the United States reach out to us and ask if they could have information about their companies on our website. I don't know how they get them in California, like law firms in California are asking, can you put this stuff that we have on the site? And we just say no, that we're keeping it local and we're keeping it nonprofit. So every entity that, if they have this resource, can make those decisions, but we are keeping this local because that's really what's going to keep people going back to it, is that this isn't the big internet. We're making it an internet that's where they are located and what they need.
And I know there was a question about kind of the long-term sustainability, and I think anytime you are hosting something on the internet, and you're making it available, there are costs associated with that, right? The software right now is under the model of open source, so it would be available, and typically we'll get volunteers to update that with new functionality as necessary. But there are some kind of ongoing hosting software costs that would have to be shifted when the research ends to a permanent entity, either a new one or an existing one.
Yeah, and exactly. I think those considerations for public health, is public health thinks about leveraging this type of platform, what should it plan for moving ahead? And I think Miss Nicole, oh, someone had their hand up.
She answered it. No worries. That was the last.
Okay.
But that I was
Great.
looking for. Very, very often, you know, when the grant ends, what happens to the project? And that's not something that, you know, in the last, you know, decades of our field that we've been able to really solve. And that's why a lot of these, even resource directories, aren't sustainable. There's no resources to keep them maintained. Or where is it going to be housed when the grant is done, and how is it going to continue to be financed and paid for? So I know that that's not an easy question to answer right now, but I think it's really important at the beginning stages of grants to really think about that.
That model actually happens a lot in software. Typically what will happen is sometimes we get corporate sponsorship where certain companies will contribute to maintaining kind of the software, and maybe even add volunteers to the engineers that work on it. So I would expect that you'd move it to a model where you'd have some kind of sponsorship. And by sponsorship, I don't mean a place for mom necessarily, but you'll have companies that will provide money to maintain resources that they think are important in the community.
Yeah, and also this isn't like a fully formed technology at this point, that we have been working on developing the components. we're going to go for another NSF grant. And that should also be mentioned. The National Science Foundation doesn't have a whole big portfolio on health research because the NIH is out there. The reason why they are interested in this project is because of these technology cost efficiency questions. You know, how do we keep this from you know, being used for good purposes? Those are questions that the reason why the NSF particularly has been interested.
Right. Thank you so much. We are actually at time. I'm sure there are more questions out there, and I see too. Dr. Monica, thank you for answering them all. We are so glad to have featured your work today, and it definitely generated a lot of conversation. There's great interest. As just one final, where can our audience, public health agency, when can we expect to hear some of the learning, some of the findings in Alabama from your work as far as next steps, and where do we go from here?
So our next steps are to apply for a larger National Science Foundation grant to actually build a fully functional prototype and start testing it. And so anybody who is interested in potentially being involved with that process, we're going to be submitting. Our timeline is this summer to submit it. So we're hoping that in the next couple of years, we can offer a lot more concrete deliverables that we can show to people and hopefully have done some testing on it by then.
Wonderful. Thank you. Joe, would you like to close it off? Any other
I
comments?
think again, this presentation will be recorded. Please do visit our website. And also it will be emailed to you along with the slides. I think all of you can see after this presentation why I thought this topic has such significant public health ramification for those of us in dementia and dementia caregiving. You know, this issue of sustainability comes to mind. And when I think of the data resources we have available as it relates to caregiving specifically, not just to mention dementia, it's wonderful that we're building registries in some states and things like that. This may be another potential strategy, particularly as it relates to caregiving need, searching for services, linking caregivers effectively to services, which we know is so essential in the space of public health and dementia caregiving. So we thank you for joining us. Please do provide feedback in terms of additional topics you would like our center to continue to address. Otherwise, have a wonderful rest of your week. And if you need anything from us, don't hesitate to reach out. Thank you to the wonderful presenters today.
Thank you.
Thank you, everybody.
Bye now.
Thanks. Bye.
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 Bye.